Yes, sir. I heard that you called for me.
Yes, doctor, this is for you.
I'm sorry, I cannot accept that.
It's okay.
It's okay, it's okay. It's my job as a doctor to provide healthcare for
No,
you.
it's okay. You help me.
It's okay, thank you. Hi everyone, my name is Alisa from Group 3 and today I will be explaining about professional boundaries in relationships between doctor and patient with families. Okay, so in a time when almost everyone shares almost everything, the question of boundaries between a doctor and a patient can be quite thornier than ever. So beyond the obvious no-go areas, which is sex and abuse, relationships can also be quite fraught. Doctors are responsible for maintaining appropriate professional boundaries in the doctor-patient relationship. So it is usually unethical for doctors to accept monetary or gifts from patients, and financial dealings besides the fees for the healthcare that we provide are generally also unacceptable, and in most instances it is unwise to hold an enduring power of attorney for your patient. And for communicating with patients, including via social media and other electronic communications, it must be strictly professional and appropriate. So text messaging can be an appropriate form of professional communication. For example, like if we want to remind our patient that they have an upcoming appointment, but we must remember to maintain a professional boundary and ensure communication via text messaging is not misinterpreted by the patient, and it is used to communicate in a way that is not clinically focused or used. So where it is possible, do not use your personal device to contact patients. It is good to practice documenting any electric communication with your patient in the clinical record. Next, for example, if we are attending to our family, it can be unethical as well, because our judgment might be blurred and biased because we deeply care for the patient. So the guidelines are there so that we can maintain strictly professional and appropriate and do not cross over the lines that have been made. So once again, do not seek or accept any inducement, gift, or hospitality that may affect or be perceived to have the capacity to affect the way you prescribe for, treat, or refer patients. So we should also be careful to not lead the patients into thinking that we are favoring them or some sort. At times, patients or their families may present to you with some small consumable gifts or koha as a gesture of appreciation for your care. These will generally be acceptable, provided they are token in nature and do not include cash donations. Yep. So that is all for professional boundaries between doctor and patient relationship. But if anybody has any questions, can feel free to ask.